So the diagnosis then, what I'm hearing, really needs to be just a call to action. It's not that we're going to sit here and just be identifying with this, but this is going to call us to action to do something really intensive with our child.
The key, Heather, the most important word, and intensity and vigilance are the two most important words to work with any difficult child. Whatever their diagnosis, whether it's trauma, oppositional, schizophrenia, it doesn't matter. Intensity is to get in there early and dismantle the system that's dysfunctional and reconstruct a more pro-social system, number one. And also two, to be vigilant. Don't let your guard down. Continue to work at it on a long term. So you set up initial safeguards to stop the problem, but long-term interventions to know that the problem may reoccur, because a child with these kind of issues most likely will have a relapse at different points in their life, because again, other things are going on. No child is born oppositional. They're made to be oppositional. Could be genetic, could be biological, could be trauma-induced, it could be mood or depression-induced, which is my opinion. The biggest childhood disorder is depression and anxiety. Depression and anxiety that leads to all these other factors and fractions of diagnosis. And those are the ones that are often the least dealt with.
Well, then let's talk about that just a little bit to add this into the whole discussion of diagnoses. And I want to touch on ADHD as well. So the anxiety and the depression, just expand on that for us so we have a greater understanding.
Well, I look at sometimes, often I looked at anxiety and depression as interchangeable terms. A lot of people will disagree. Depression is where people or organisms have gone through some difficult times where for adults they can wallow in pain, suffering, cry, and express themselves, become lethargic, apathetic, withdrawn, suicidal, or even homicidal as it may be. But for children it's very, very different. Depressed children act out in a very defined, irritable, angry, oppositional way, because the pain within them, especially if they have developmental challenges in the brain or in their trauma history, they're not going to trust people to discuss the issues, nor do they have the ability or maybe language repertoire to do it. So they're going to lash out against others. Henceforth, you have what we call an agitated depression, or depression based on trauma. Leave me alone. I don't want to talk about it. I want you to get out of my face. And they come across very defined when they're in such intense pain from what their history has dictated to them. Whereas in anxiety, they develop a very reactionary pattern. They're in your face. They're very sensory defensive. Leave me alone. Stay out of my room. I don't want to be bothered. They have so much anxiety. It's time to do homework. Why? I can't. And they get very obsessive. They get very nervous. They can't handle transitions. They panic when you change their food, their clothing, anything around them. So it's a very intertwined pattern that's often missed frequently, and people look at the outcome of the oppositional behavior when basically you have a very unhappy child.